COVID-19 vaccine. Three factors should be considered in vaccine rollout. Promising COVID-19 vaccines are coming out, but how should these vaccines roll out in communities? Each dose means the life of one person. Thus, a clear plan is a must. Experts at RMIT University and the University of Agder found three crucial factors in distributing the vaccines. They used a model to examine ways to allocate doses to populations. The model, however, is applied to a scenario with 6.9 million people in Victoria, Australia, prediction for 2021. A total of 325 medical centers can spread the doses. In the model, these centers range from small centers to large city hospitals. When the doses reach Australia, the primary route for local distribution is roads. So, local government units must prepare lots of refrigerated vehicles. All roads, particularly going to rural areas, must be accessible. They also accounted for specific community sections with high exposure risk, like city dwellers and healthcare workers. These sections are not evenly scattered in the region. Multiple scenes were tested and three key elements came out. First, medical centers should be big enough to handle the populations of cities. The size determines the maximum doses centers can administer in a day. The size too affects the number of health workers and storage space of vaccines. The 326 medical centers in the model could vaccinate 6.9 million Victorians in 60 days. It would require at least 9,500 vaccine packs with 12 vaccines per pack every day. Yet, it only covered one shot per person at stable supplies. Second, transshipment plays a role in managing supplies. All medical centers should be ready for this function. Whenever one center is short on supplies, the nearest center needs to lend a hand. For instance, City A has a less vulnerable population than City B, but both receive fixed vaccine doses. With a more vulnerable population, City B may experience supply shortages. City A may prevent that by giving spare doses. The downside of transshipment is an extra burden on the road. And third, vaccine packs have to be the right size. While large vaccine packs hold more doses, they are problematic in transshipment between medical centers. They need to break them into smaller portions for safe transport. Despite the model's limitation, the key factors are likely applicable in regions outside Australia. As such, a good balance between these may lead to better vaccine rollouts. The experts posted their analysis in the conversation.